How we impact others and how we feel about ourselves as we age and the onset of other diseases as we do get older, having the mental capacity and the fortitude to deal with it is very important, and the way in which we can improve the health of the brain and people's thinking will enable them to have a better quality of life in their later years. I'm committed to making the lives of the aged as best as they can be through focusing on the brain fitness, care of the brain, and preparing ourselves for aging.
Baycrest has been blessed to have on this campus some of the greatest minds in the area of aging and cognitive neuroscience that exist. Folks that have won the major awards within the scientific enterprise, folks that have led the way, not followed. We have leaders in the clinical realm as well, leaders that have helped Canada to establish standards of care within nursing homes, standards that now are being embraced not only across this great nation, but across North America and the world. There is a commitment to excellence at every conceivable level of the organization. Does that mean we always achieve excellence in every conceivable thing we do? No, but it means that we are driven to try to achieve excellence. There's now recognition outside of the four walls of this campus that Baycrest has been and is onto something very special that is going to have a measurable impact on the well-being not only of older Canadian citizens but older citizens worldwide. The recognition of Baycrest excellence by our government, an example being funding by the Ministry of Research and Innovation of $10 million to launch Ontario's first Centre for Brain Fitness, I think is tremendous recognition. There is recognition by the Alzheimer's Society of Canada that Baycrest is now a global leader, and so we are forging a stronger partnership with them as well. There is a very strong partnership that has emerged with the NHL Alumni Association, which also speaks to the endorsement of Baycrest as a leader that will transform the impact of how we experience aging. One of the most important initiatives that we launched this year was what we called the 100-Day Plan. A crucial part of this was to listen to our staff, and this was called our listening tour. And over the course of 3 or 4 months, I had the opportunity to listen to the ideas, the thoughts, the advice of over 1,200 of our staff. And this was designed for us to gather as much information as we possibly could about Baycrest's present strengths, as well as our opportunities to do even better. Probably the most significant change put in place this past year was the move from a functional organizational model at Baycrest, meaning discipline-specific, to what is more commonly adopted in healthcare now as program management, where the disciplines are brought together under a unified leadership structure. And this helps to foster interdisciplinary collaboration. It tends to foster more creativity and decision-making at the program level. And it's a move that I think Baycrest was ready for, and we've taken. Here at Baycrest, people give not only their professional selves to the place when they come to work every day, but they give a big part of their personal selves. It's a very special degree of commitment that I've not seen in any other organization I've worked. And that same degree of commitment you can see in our donor community, in our board members, and in our volunteers. How many organizations have thousands of volunteers? I mean, this is an extraordinary accomplishment here at Baycrest. There is this ethos here that there is no more important cause than to do what we are doing here day in and day out. Baycrest will be the iconic symbol of what we as a society can achieve in maximizing the well-being of people. We will be the Sloan Kettering, the Cleveland Clinic, the Mayo Clinic of what we do. There will not be a hesitation when people ask who is the world leader in affecting the well-being of older people. It will be Baycrest without a pause.